So we're proud to be a sponsor of the Housing Works Summit. I am the Director of Real Estate Development for Ryan Companies. I want to keep the infomercial short. We've got some information out there on one of the tables. I'll let you take a look at that. But primarily, we're a commercial real estate development company in office and industrial. We're probably most well known here in town for the Oracle development out at the waterfront, maybe part of those high-income technology jobs that are coming to town, but part of our economic growth as well. But more directly, I'm very proud to be the developer of two affordable housing developments, the Reserve at Springdale and the Urban Oaks down in the southwest of town. So we're very proud to be contributing that to our community and being part of what we hope is the solution in some of the housing that we need. So let's get to the summit. And let's get to this panel. Affordable and stable housing can play a key role in facilitating economic mobility by providing connections to education, health, and transportation. As Austin grows at a rapid pace, it's necessary to understand how these connections to housing can be strengthened to create opportunity for all. This session, the panel that we have here, will explore these issues, and it's moderated by the Honorable Sherri Greenberg. Ms. Greenberg is a clinical professor and fellow at the Max Sherman Chair in State and Local Government at the University of Texas's LBJ School of Public Affairs. She's also a vice chairperson and on the Board of Managers at Central Health, a member of the City of Austin Regional Affordability Committee, and a member of the UT Opportunity Forum Steering Committee. So without further ado, I'll hand it off to Sherri and the panel. Thank you.
Thank you very much. Appreciate it, and appreciate you being a sponsor of this wonderful symposium that we have the opportunity to participate in today. I want to start off by saying that you will not be having any death by PowerPoint during lunch. This is going to be a conversation. We've been having some wonderful conversations, and we're going to stick with that. I want to introduce our panelists. I am honored to have them up here with us today. Paul Cruz, who is Superintendent of the Austin Independent School District. Rob Spillar, Director of the City of Austin Transportation Department. Christina Dunigan, who is a graduate student and researcher at the LBJ School of Public Affairs at UT Austin. And last but not least, Mike Geeslin, who is President and CEO of Central Health. You will notice that you have cards at your tables, and please feel free to fill those out. Put your questions down on those cards, raise your card, and there are people who will magically appear to pick those up, and they will make their way up to me so that we can try and address your questions during this lunch panel. And with that, I have asked each panelist to give a brief, about a 3-minute opening about why are they here? Why is it important for you in particular to be up here as part of this conversation where we explore housing and social and economic mobility? And they each have a very particular perspective to add. So we will start here.
Okay. All right. Thank you, Sherri, so much, and thank you all for being here today. My connection to the topic for the day is both as a professional, as a superintendent, as an educator, but also as a citizen. I live in the Austin community and have lived here for a while, and I love Austin, and I always want to make sure that we're making it a better place. No matter where it is today, it's got to be better in the future. And as the Austin public school system, we do educate a little under 83,000 students. 70% of those students are Hispanic or Black. About 60% poverty. Our poverty rate is actually declining and has been declining over time. At any point in time, we have about 2,000 students who are homeless students in the Austin Independent School District. So it is very much an urban school district. It is the 6th largest district in the state of Texas out of the 1,200 school systems. So where we are a public school system, where kids pretty much where they live, that's where they go to school. What we see is the way the city of Austin changes, the Austin Independent School District is also changing. So as property values increase and housing becomes less affordable and less available in many cases, we have students actually moving out of those areas. And so we actually, out of the urban core, we have more students who are leaving the urban core and moving into the outer edges of the Austin School District. So as the Austin city changes, the Austin Independent School District changes as well. That has another impact on us as far as school finance system. So the way school finance system goes as far as for funding and tax purposes, it is based on property values and also enrollment. So as property values go up, as they are in Austin, enrollment goes down because of less affordability in Austin. a higher payment goes into recapture, into the state. We are the highest payer into recapture. This year, we project to send to the state $533 million of the Austin tax base that goes to the state level. Last year, there was about $406 million, and every year it'll go up another $100 million. And that's the money that we use actually to operate the school district, to pay for raises, new programming. So that sort of has two different impacts for us. One is just the changing demographics and enrollment, where individuals can't afford to live in Austin, and then the other is the school finance system. Yet we still have 22,000 students who are English language learners. We still have about 58% students of poverty, and we know we can get more kids to graduate and go on to college, but it does take resources to do that. So those are just some ways that it impacts the school district.
Rob.
Thank you. So I'm Rob Spillar. I run the city's Austin Transportation Department, and transportation is an important element when you think about affordability. A lot of people that are looking for places to live ignore the cost of transportation, and so what that means is you've heard the old adage, drive till you can qualify, or move out to find less expensive homes. The problem with that is you are absorbing an unknown cost often with regards to travel. There are some studies out there that say once you live more than about 12 to 14 miles from your work location, whatever savings you've achieved through lower mortgage rates or lower housing costs have been eaten up by your travel costs. And of course, they're typically talking about auto travel, not transit travel. And so at the Transportation Department, we really are focused on how do we connect people to opportunities and provide healthy, safe commutes. Let me just expand on that. A lot of people think that the Transportation Department's prime responsibility is to reduce congestion. And that's just a byproduct of our growth that's going on here. It's a byproduct of our economic vitality. And I'll admit it here, there's not much I can do about traffic congestion on most of our roadways because they're full. They have been for 40 or 50 years. But what we can do is help people connect with places of opportunity, whether that be work opportunity, health opportunity, and so forth, using new modes of transportation, providing people that can take bike or walk that opportunity, so in a sense they get out of the way for people who need to use transit or automobile to get to their destinations. In terms of healthy outcomes, which directly impacts, again, affordability, we know that as commutes approach 20 or 40 minutes, the social networks that people have start to break down. And we know that that increases stress and directly goes to things like increased divorce rates, increased heart attacks, increased stress-related illnesses, breakdown of the family structures. And so if we can provide people better choices, better options than having to be stuck in traffic for 20, 40 minutes, an hour, then we have a better, more affordable community.
Christina.
Hi, my name is Christina Dunigan, and I'm so excited to share some of the work that my policy research team is doing at the LBJ School, directed by Sherri Greenberg. We've been tasked by HACA and Housing Works to take a look at affordable housing in Austin, and we know there is a need for more affordable housing. What our work is trying to do is to understand that need, to understand how housing in connection with education, digital inclusion, transportation, and healthcare impact someone's ability to access social and economic mobility. To answer the question, how does where you live provide or limit opportunity, and to do that, we had to start by talking to residents, and our resident focus groups gave insight into this interconnectedness that I think is a theme of this conference, this interconnectedness of all of these topics, and the unique, diverse needs of our Austin communities. And based on this information, we want to develop use cases to follow a resident's journey to find housing. What resources can they access? What services are provided to them? What challenges do they face? And to create these use cases to inform the creation of future digital tools or services. And then another piece of our research is looking outward to other cities to find out what case studies and examples are cities doing to address their housing needs. And we're finding that a lot of the innovative things that they're doing aren't legal in Texas. So then kind of coming back, and speaking to policymakers and community leaders and find out what is being done here in our unique city. And so our kind of multi-pronged approach really wants to understand how housing impacts social and economic mobility, and we'll be publishing a report in June of our findings.
Thank you. Mike.
Thank you, Mike Geeslin, President and CEO of Central Health, and thank you for having me on the panel today, and thank you all for being here. So why are we here? And on behalf of Central Health, we're here because we have an ongoing and a passionate commitment to this community to make it right. And what does that mean, make it right? Well, when you look at health, what you tend to think of is how much money do we spend on a particular disease or a condition? How much money do we spend on endocrinology or surgery or so forth, or primary care? But it's actually much larger than that. Right now, when you go see a doctor can get on a tablet or assign somebody to do this, but she or he can get online and order prescriptions or write prescriptions. But what if you could prescribe affordable housing? What if you could prescribe a better environment? That is a stretch. Now, if you try to go for that all in 1 year or 2 years, you'll likely have a lot of great conversations, a lot of ideas, and not a whole lot will get done. So we can't be afraid of the small. We have to be willing, again, as part of that commitment to make things better in this community. And as a player in that, it's taking those incremental steps in the healthcare world to get to the point where we can start addressing some of these issues that affect health. Your housing, the condition of your housing affects your health just as much as the location of your housing. If you look at the transportation, we recently, back in the fall, issued a demographic report where we looked at not only where was the population going to be, not where they have been, but where will they be in the future, but what were the health conditions around that population. You do the transportation overlays, although we had limited affordable housing data in this report, you put all this together and it screams out to just beyond the borders of medicine and looking at some of those social issues that affect someone's health. So as part of that commitment, we're here to engage in this dialogue, but more importantly, take away action items.
Thank you all very much. I wanted to start off with asking you all to respond to what do you think are the most important connections among education, housing, and transportation? What are the most important links among the three of those?
She said education, so.
All right, I can do that.
First, yeah.
I didn't make eye contact, but I'm going to go first anyway, right? It's a teacher thing, right? If you make eye contact, you're the one who's going to be called on. There we go, right? So I think the main connection is just, first of all, even what you see on the stage, individuals that represent different organizations of the entire city. And one common thread is how do we all work together, or not, but how do we work together to actually improve and enhance the family experience? We know that when a family has to move because of affordability or because rent goes up or whatever it is, right, they're going to miss school. So anytime you've had to move, think about it. Takes 5-6 days to move. It takes resources to get electricity hooked up and everything else hooked up. It takes time to do all that. You may also miss instruction. So our students are out 5 days. You move many times throughout the year. It impacts you now in the way you socialize in a school. It impacts you as far as resources and how to get to a school. It impacts you about maybe other needs that may not be met because those resources aren't available. So I do think the one common thread is, and I know we have some partnerships like this that exist already, and actually we just, with Mike just the other day, on health conditions for our families, right, is how we all work together as different organizations that represent different parts of life and maybe even have different governance structures. How do we come together to either shape policy or to actually combine our efforts to support our students and our families? The family's just trying to look for services. Where's my school? Where am I going to live? What about health care? How am I going to get to school? Well, that pretty much represents the big organizations that are represented here. And while for us it's around a little under 83,000 students, those are a lot of families. And just sort of time away when you miss school or you have to relocate to another school, there are socialization issues there. You miss lost instructional time. There's loss of school funding because of not coming to school. We may lose you for a few days, or you may not come back to school. All these are just the way it happens, whether their family wants that to happen or not. They're responding to conditions around affordability. And I think that's the one main thing that when we talk to our parent support specialists and our principals, It's really about housing, and those have a multiplicity of impacts for our students.
And I know those parent support specialists, there are about 60 of them, is that correct? Spend a
Correct.
lot of time trying to help families find housing. And of course, we know that the more times a child moves during the year and attends different schools, what that means for educational outcomes and what that means then for their future economic mobility. You mentioned, yes,
I
please
was going to
chime
say,
in.
I also wanted to talk about sort of financial bottom line. Paul, you talked about shipping $530 million out of this region this year, 400 last
Right.
year. And I hope
I think the mayor called that a state property tax.
Yes, you think he did. But those are lost opportunities because those are monies that we couldn't spend first to fix whatever needs to happen to the school district here, but we can't spend those same funds on infrastructure that we so badly need. A couple of years ago, we asked the voters for a $750 million bond. It was the largest infrastructure bond we'd done since the airport.
Right.
And yet we're spending that much, sending it out of our community every year and a half, not even quite a year and a half, to other school districts. And it dawns on me that this community, because we're growing fast, because we're enjoying the strong economy, is causing problems on the school districts. At the same time, we're shipping so much of that money out, we can't spend that money here in the region on needed infrastructure.
Right, and not to get too wonky, but I have taught finance. What you're getting at is this issue of the overlapping taxing jurisdictions for property tax.
Right.
So to the extent that the school district, has to collect more money because money is going back to the state to be redistributed, then look, when we get our property tax bill, what do we typically look at? We look at, this is the amount we owe. If it's the same, we're like, eh. If it's less, we're happy. And if it's more, we have that angry face. And most of us don't look to see who is charging us what. We just care about the bottom line and what's the check we have to write. So I think what
And
you're
it's
saying
the
is,
notion of capacity. How much
Right.
capacity does this region have
Exactly.
to pay for governmental activities, and
Right.
appropriately so? Yes, I'm not asking the school district to pay for roadways or transit, but if they're not using capacity, then we can share it amongst our other entities, whether it's doing this or
Right.
doing health-related stuff
Exactly.
within the region. It's not just transportation.
right, because those
Yeah.
taxing jurisdictions are overlapping. So if it's not being used to be sent back to the state, that potentially is not only more capacity for the school district, but for mobility and transportation and for healthcare, right, Mike?
Right. And I think, what you're getting at is creating a sense of place. And you all have probably heard this before in Kirk Watson's 10 and 10. One of the tenets is create a sense of place. And I'm looking at Paul, and it reminds me, if you think about any neighborhood here in Austin, and think about the elementary school, and if you've had elementary school age kids, how much an epicenter of community life that was. I mean, there's all things that happened there after school let out, all kinds of community meetings, for some of you religious meetings on Sundays or Saturdays. And so you've taking that a step further, which is we need to look at our assets in terms of real estate and buildings and facilities and what our infrastructure is. And to the extent that we can overlap, while that may seem redundant, it is not counterintuitive, because if it is a sense of place, if it is truly a community, then community should not be spread out all over the place. You ought to be able to bring everything in together, whether it's education, healthcare, transportation hubs, or transportation solutions. And having that in one place, I think, helps us to maximize on those resources, and we're not double spending on things in a way that doesn't really have any meaningful impact in people's lives. And then another issue around healthcare in terms of how all this fits together, I think it's important that not any one of us decides, oh, we're the glue that holds it all together. It's all of us. No one of us is, and don't take this offense, panel, not any one of us up here is the bottle of glue, okay? So, but I think understanding that and having that type of cooperative environment is key.
And you brought up something that's very important, and that is when we talk about housing, of course, you're place-based. Your house is physical, and it is rooted in a location. And I think that location can either give you opportunities, whether it's in education or transportation or healthcare, or it can mean that your opportunities are limited. So maybe panel so we can explore what some of this means, either by the nature, and you started talking about it, what's affordability? We tend to say if you are spending, 30% or more of your income, that's not affordable. Well, look around Austin, what are we doing? And then if you layer that on, spend 30% or more of your income on housing, plus your utilities. If we then layer on transportation, you get to 40%, we say, well, that's really not affordable. Look around Austin, what are we doing?
Right,
yes.
Here's a good example. We use a rule of thumb that if you can get rid of a vehicle, if you own one vehicle and you can get rid of it, you can save $5,000 to $7,000 a year by not having to pay insurance, auto payments, etc. You're still paying for transportation in terms of transit or whatever means you use to get to your place of occupation. But the private automobile is actually a burden, and so that's where you see innovative technologies coming in to share vehicles. There's some cities that some new programs through GM Maven are allowing multiple people to own single cars where they need a car on the weekend or for trips to the grocery store or whatever, but not all the time. I think those have the opportunities to increase affordability by simply allowing people to ditch their cars.
Well, yes, it is. All those costs that people don't think about that are associated with the car. So you may move further out because this is an apartment that is affordable or a home that's affordable, but you may not have any bus line that goes there or not the first and last mile. Right. You may say, now I'm dependent on a car. You may only have one car for the family. That car may not be in good condition. You have the maintenance of the car. You have the car insurance. And so all of that adds up. But Mike, maybe you could talk about, I think Central Health with its community care, which is part of the Central Health family, is embarking on piloting a program with Ride Austin.
Yes. And so there were a few delays in that program, but what we're marching towards, and I want to recognize Chris Rios, who's in the audience, who's the chair of the Community Care Board of Directors and a great partner, not just for Central Health, but critical to this community. But in looking at transportation solutions, finding rideshare programs where at no cost to the patient, we have a way to bring them into healthcare. Typically, we think of an epicenter, and you're kind of on your own to get there, and if you have to piece together 3 and 4 bus rides, well, that's time away from work, which jeopardizes your employment situation, which can make it even harder on you as an individual. Healthcare should not make your life harder. We need to make it easier. And so in doing that, by having these rideshare type arrangements, and we'll pilot this, and the data's going to be a little slow coming in, but when we are smart enough, not when we're perfectly smart, so to speak, but when we're smart enough, we'll take the next step and then scale that up. So again, we can go out and bring people into healthcare. And then we also have mobile solutions. If I could kind of tag one on to that.
Yes, absolutely.
When you look at healthcare, it's not just about bricks and mortar.
Right.
And where do we put a building and how big does it need to be? It is also the overall delivery strategy, which is how do we get out there to people? If we can't bring them in, how do we push the care out? And we actually have mobile teams right now that have been funded through demonstration projects and are looking at in future budgets, how do we fund this? Because in healthcare, and remember this, if you want something to happen, reimburse somebody for it. Pay them for it.
Yeah.
Okay? Don't just hope for it. Pay them for it, and you'll get the outcome that you're looking for.
Yeah, absolutely. And I think that piloting these programs is really important because from that you can see, is it going to work? If not, maybe it's not ever going to, or can you make some adjustments and then scale it? And I think with these innovative solutions for transportation, we have to keep in mind is, when we're talking about economic and social mobility, many times we're talking about people who are unbanked. Not only do they not have credit cards, but they may be unbanked. They may not have the types of devices. I see one sitting right back here that we think that everybody has, or may not have data plans. And so what you're looking at, frankly, is a lot of times saying, okay, we're going to have to come up, we're going to have to reimburse, we're going to have to come up with a program where we're going to subsidize these rides through someone such as this program with Ride Austin to get people to the clinics. Because if they don't get to the clinics, right, and they're not healthy, can they get their education? I mean, what kind of situation are you seeing with this link between healthcare and education as far as your student population?
Yeah, well, it's significant because our core mission is around educating students, and that's what our core mission is about. But obviously, for kids to be ready to learn, they need to feel well. They need to be well fed. We have many of our schools actually have after-school programs and dinner as well. So breakfast, lunch, and dinner at a school. And for us, that's a little under 60% of our kids of poverty. So it's still significant. But I do think with healthcare, just as we all look at from our employers, and AISD also employs 12,000 people. So when we look at healthcare for our students and partnerships like I mentioned with Central Health, we also have then healthcare for our workforce,
yeah.
And we are one of the largest employers in the Austin community. That's significant for us. That's going upwards of $100 million a year that we put into healthcare for our workforce. And I know all entities, the largest ones, the City of Austin, the county, UT, AISD, are pretty much every year it goes up more, even though the institution may contribute more. Then the individuals who are the employees also have to pay more into it. So it just has a compounding effect. So how, again, we work together to support our efforts through saying we're all trying to reach these strategic goals and outcomes. How can we do this together? For the school district, as I mentioned, we actually have, I think, a great demographer in the City of Austin, and
yes.
He works very well with us, and talked about the way the City of Austin is changing. He was actually said, it's really great the way AISD has been able to hold its capacity, students, just given the quick turn. And there's about 11,000 students who come in and out of AISD in any one year. And I remember even that as a teacher in an urban school system, that the kids you had on day one aren't the same kids you're going to have on the last day of school. Urbans just work differently. But we actually had some properties that we really weren't using, or maybe we could use it in a different way. We actually put it out to the city and put out a request saying, here are some available properties, tell us what you want to do with it. And we were able to then repurpose eight different facilities or parcels of land out to the community. 5 of those were sold for about affordable housing, and for housing, and 25% of that was for affordable housing. We also looked at for our workforce, so also give our teachers an opportunity to be part of that housing once it becomes available. So, but here are just some land or property facilities that weren't being used, or maybe could have been used in different ways. Austin has really smart people, and we know what the needs are, so could we then repurpose something that we have as far as the school district, but then repurpose it for the community? And so I thought that was a good example for AISD to look at 8 of those properties, and then 5 of those looked at about affordability, which I think is something that's so significant for all of us.
And as we see here, affordability is all of this. It's, your health care. If you're not healthy, you can't get an education, you can't get into the workforce, but it's your transportation costs, it's your housing costs, it's your ability to be digitally included. How do you apply for jobs today? Well, you apply online, and most of the time, I'm here to tell you, it doesn't work on your phone either. You actually, you have to have a laptop to apply for a job. So we also, and I know there's another panel that will be covering that, but all of these work together. And I'm happy that you brought up, because we know for our workforce, it's healthcare and it's the housing. And Christina, maybe you could speak to, in some of our focus groups, what we've heard about the
Right.
situation with housing here.
Right. It's so important that we're talking about housing in the way that it's connected to these different topics, right? Education, transportation, healthcare. Because what we found in our focus groups is that in the lives of Austin residents, these things don't exist in silos. They are intimately connected with one another. One's ability to access healthcare or to find a job is intimately connected with their ability, with their access to transportation. So what opportunities are there, in the policies that we create for connection of public agencies and nonprofits across the spectrum to come together and think about these things the way that Austin residents are thinking about them, as kind of the whole picture that affects their lives. So I think, it's great that we're having this conversation about, connections that are already happening, and to keep in mind that, moving forward, those policies can't continue to exist in a silo.
Yes, and I know that certainly themes that we have heard from folks when we're out there speaking with them are not just the cost of housing, but what that means as far as where they're located. And they may have been in a location previously where they had access to a bus route, where they had access to a clinic, where they knew their schools and their communities. Just this week, we were conducting a focus group, and we're listening to some folks who were saying, you know, we moved because we wanted our children to have better air. They actually said that, to have better air quality in where we're living, and better environment as far as breathing and outdoor environment. But we knew someplace now that's so far out that we're 15 miles from the nearest bus. And so there are pros and cons. We now live someplace where the air is clean, but we're 15 miles from the nearest bus. Or we heard people say, you know, we have moved because where we were was no longer affordable, and we have lost our sense of community. We had a community that we had lived in, and we have lost that sense of community. And we know, frankly, that that plays into health. Rob, you mentioned that, and Mike, maybe you could talk some more about what you've been seeing for the social determinants of health and the sense of community and what that can mean for health.
And so to answer that question, first let's look at a health condition. And you know, you talked about a family moving just to be able to get cleaner air. Let's take a child who has asthma, and the Centers for Disease Control estimates that 1 out of every 10 children has asthma in the United States. So let's say law of large numbers holds up here. That number is probably a little bit higher if you break it down by urban area, but let's just say 1 in 10. Well, as it so happens, Central Health, we serve 1 in 10 of every resident in Travis County, meaning 1 in 10 of every resident in Travis County receives funding through Central Health. So whether you're talking, regardless of who pays, let's just focus on that child for a moment. And let's say that child lives in 78744 zip code, Dove Springs. And let's say that they live in non-owner occupied, basically rental housing. Now, what if they're not changing the air filters? What if they're not providing pest control? What if that family, in working multiple shifts, and by family you can't just think of folks that maybe live in one house, think of the extended family and the community around, but within however they define family, there's the normal stresses that any one of us, if we had to endure, we may not be able to make it for very long. So they're doing extraordinary things. But yet, they're having to pick their kid up, put them in a car, and take them to the emergency room at 2 a.m. because he can't breathe. Well, the doctor can write a prescription for an inhaler, and you can go through various emergency protocols and get the patient stabilized and send them home and get them to school, maybe even by the next morning. It was at 10 a.m., I believe. So, but is that really fixing anything? All right, now let's wind the tape up. I'm dating myself, VCR tape, excuse me. Let's reverse, okay? Let's reverse and go back upstream. Look at the zip code. Zip code matters.
That's right.
And look at the housing condition for that individual. What if in the normal visit with the doctor, they figured out landlord isn't changing air filters? You ever see anybody come in your house, pull the things down from the air or down the floor? No. Anybody ever come in, spray the outside of the house with kid, pet-friendly pesticides to be able to deal with cockroaches? No, never. Do you have enough time to clean your own house? No. We're working 3 shifts in my house, each of us. We don't have time for that. All right. That is where the medicine is. It's not the inhaler. So that's where I think we need to focus. And so by having innovative ways to go in and say, all right, landlords, let's try the incentive route. What do we do to incent you to get the quality of that housing to what it needs to be? So that kid does not have to go to the emergency room just to get a breath of oxygen. How insane is that? So I think there's a lot that we can do upstream with social determinants, specifically related to housing, but there's other experts up here that can talk about that and transportation and education that are equally as important too. I just got to pick that one example because it really hits home and it's very, very real. I've heard it from a family myself.
Yes.
You know, if I could speak to this issue about, I just moved out 15 miles, I'm 15 miles from the nearest bus stop. And, you know, those are the hardest conversations I have to have is with folks who have moved somewhere for affordability. and then call and ask, well, why don't I have transit? And oftentimes it's because they've moved outside the transit authority's
right.
service area,
right.
or they're in such a low density area that it's just not financially feasible to
Right.
provide those kind of services. You know, transit's provided by Capital Metro. I think they do a good job, but they're using every penny just to serve the most dense areas of our community, let alone the far-flung suburbs that are building out beyond their reach right now. So it's really a dilemma, again, getting back to helping the general population understand that when they're thinking about affordability, not just to focus on, you know, the residential costs, but the health impacts, the health costs, the school costs, as well as their transportation costs.
Yes, absolutely. And feel free to send those questions on up. I'll start incorporating them. So write them on the cards, raise your hand, and we'll send somebody by for them. Yes, the interplay is really what is so important. And I think we started off the day hearing that from Mayor Adler and from Judge Eckhart, and it certainly continues and is, I think, the theme for social mobility, for economic mobility, everyone getting out of these silos. But if we take, again, just this physical rooting, this physical location of your house, from that we can see the advantages or disadvantages to the condition of your house. Do you have parkland around it? Where is the school? Do you have transportation? You know, can you get on internet? All of this comes from that physical location of where you call home, right? And I think it all stems from there. But having said that, what do you think are the largest barriers to economic and social mobility that you're seeing from your vantage points?
Well, everybody looks this way, so I'll take this one. If you look at health, and again, I want to go back to what I said, not any one of us up here are the glue that holds it all together, but I want to focus on health for a moment. If you're not able to maintain good functional health, and let's say that you're of wage earning capacity, then obviously it affects your ability to consistently earn wages, to have stable employment, et cetera. And in the gig economy that we're in, a lot of folks that we serve, they are one shift away from going from 200% of federal poverty level to 100%, meaning they lose just a little bit of their employment earning capacity, and even with what they have left, they're knocked down a whole nother octave on the poverty level scale. So that is a huge determinant in your ability to earn income. And then there's a trickle-down effect. The question is, does that get you the transportation that you need? Does that allow you to be in an area, in a catchment area, especially if it's elementary school? You know, I'm speaking as a parent here, but you're really hypersensitive about your elementary school. And not that middle school and high school isn't important, but you know, does that allow you to be in an elementary school catchment area where you feel like your child is going to have a good sense of community along with a good education? Remember what we said earlier, how those schools can be the epicenter of the community life. So link it all back to health. If we're not able to help you achieve the health that you need, then things start to fall apart. But again, I could equally, you know, point to if something happens on the transportation front or the housing front or the education front, and if you're in good health, things could all start to unravel there as well.
Well, and I know from the standpoint of Housing Works, looking for housing all over to meet everybody's needs, one of the big questions is, how do we have the housing in high opportunity areas? And Rob, not to bring up a subject that is a good one, but maybe one that was a little disappointing, that was when the City of Austin was one of the finalists for the USDOT Smart Cities Challenge, right?
Right.
One of the things that we talked a lot about was the ladders of opportunity,
right,
and sense of community, social determinants, but the high opportunity
right,
areas. Perhaps you could address some of that.
Well, so if you don't know what Sherri's talking about, the city competed for a
Yes,
federal grant, $50+ million with 9 other cities, and we came in second. I like to tell people. The good thing is that we also didn't get the purse strings that came with that
right,
purse that was promised. And so, you know, we have a really dynamic opportunity in our community right now, in that transportation is being infused with technology like never before. I tell young engineering students this is probably the most exciting time to be in transportation. The thinking has expanded so that even when we talk about broadband, I think of that as a transportation technology, because if we can get people not to travel, to be better consumers, to think about transportation, mobility as a commodity, and therefore if they're good consumers, they can reduce their cost on themselves, whether that means using a different mode or choosing not to travel, or simply having your groceries delivered if you're able to. Cuts down on your impact or your footprint. And so, the other thing is it was a dramatic eye-opener. You heard me tell earlier that my job is not to reduce congestion in town. That might get me fired. Please don't say that. It's to connect people to opportunities. It's to connect people to work opportunities or education or religious or health opportunities. And when you start to think about the basic purpose of transportation, connecting people, then you suddenly have a lot more tools, because it's not about just providing more capacity. It's also maybe about moving those opportunities closer to where people live. And yes, vice versa. And we're working on Code Next, moving people closer to the opportunities. I think one of the biggest things that Austin needs to do is realize, we're a big city now. That's the reality. We like to think of ourselves as small towns, but that's not true. And we need to get really comfortable about absorbing our fair share of the growth that's coming to this region. And to do that, we have to build higher densities. But the wonderful thing about higher density is that opens up more tools, makes more tools like transit and walking more cost effective to supply. It allows Paul to put more schools closer to those high density areas, or even reuse historic schools. It allows Central Health to put clinics where the people are. So there's a lot of good things. Yeah, there's a lot of problems that come with density, but that's sort of where we are. We're on the verge of a major change, and we've got to think about how we do that. Technology can help. Technology can help gain access, but we have to think broadly and be ready to take those opportunities when they come.
Absolutely. So I have some questions now, thank you, that are coming up. And since you opened that Pandora's box called Code Next, which is the, for those of you who, it came up earlier, but you may not have been here, the city has a comprehensive plan, Imagine Austin, that's about 5-6 years old. And from that came the need to rewrite the city's land use plan, land development, zoning, all of that. That's called Code Next. And it's on a journey, Code Next.
Yes, it is.
I think next week, shouldn't we be getting a new version? Somebody tell me if I'm right or wrong, but I think, yes, I think it's next week. So we have a couple questions regarding Code Next. One is, the first one is, can Code Next impact any or all of these issues that we are discussing, and how involved are your organizations at all with Code Next?
From AISD, we're not writing it, but I will say, and I still have an answer in my head. I haven't had the question yet, but somehow that answer is going to come out later on in some of the responses. But we actually have been working with the City of Austin. We've actually enjoyed a partnership with our mayor and the City Council over the past few years that I think has been very strong, not only in just supporting the PSSs and resources that we've lost after school programs, but also in Code Next. So actually working collaboratively to address some of the issues that are happening around AISD, and where do we have significant enrollment issues? Because even within Austin, we have many schools that are over-enrolled and are becoming more over-enrolled.
And you have some that are under-enrolled.
And way under-enrolled, exactly. Yes. And students just don't live there anymore. And so we've been very much with the City of Austin working through that.
And I think you bring up what is a real conundrum for the Austin Independent School District, because as you said, you have some that are now over-enrolled, but you have some that are under-enrolled, and some of those are where people can no longer afford to live in those neighborhoods, and they have moved further out, right?
Exactly, they have. And it runs the gamut. So working with the city as far as saying, here are the implications for AISD. This is what we're looking not only from the past or today, but also in the future, because it is looking about the future. And we also want to make sure that our kids are able to walk to schools. We do transport 23,000 students every day. So we have our own bus system, and that's a $30 million investment. Every year, we pay to transport kids to campuses. And we want kids to have choices on when they want to go to school. So we do have to work with the city as far as roadways around new schools or changes in school environments. So working very closely closely with the city on Code Next to make sure we're getting kids to these opportunities that are maybe closer to their homes or not. But that's something that's also different with an urban school system, different from other districts. You have to provide an array of opportunities for students. We educate students between the ages of 3 and 26. And those needs are significant. And as an urban school system, we have to be responsive to the changing demographics, changing needs and expectations of our parents and our families.
And Rob, you are the other one up here who I know has an organization or entity or department, should I say, that's involved in Code Next, so maybe you could speak to that.
So parallel to Code Next, there's a major transportation effort going on. The Austin Strategic Mobility Plan is also moving forward. It is linked and intertwined with Code Next in terms of, you can't have new land uses without appropriate transportation access to those locations. One of the dilemmas about infrastructure is anytime you invest in infrastructure, whether it's water and sewer or new streets or new transit systems, you will increase the pressure of the market on the surrounding land use, which has a direct impact on affordability if we don't turn around and wrap it with policy that is in Code Next to maintain that affordability. And so it really, I would tell you your city departments that are working on this, I think, have a really good understanding of the balance between land use and transportation, that they go together. We have an upcoming public open house called Traffic Jam, which will be the next opportunity to look at several different scenarios that, again, are based on outcomes of not just the transit planning in this area that's going on, but also the land use. And I'd encourage you to look up Traffic Jam. It's a cute word, but look it up and you'll find a public process here in town.
But these are really important.
It's very important to us.
Really important concepts that you cannot put up walls or dividers between land planning, between neighborhood design, and all of these, and then the ripple effects that has on play space, on who's living in a neighborhood, on the access that they have to opportunity and social and economic mobility.
Right. This region right now, I would tell you, has more transportation projects by dollar-wise under construction than probably ever before between all the different agencies. But without good land planning and thoughtful land use, those investments will be for naught in just a few years.
I have some other questions up here that address opportunities for workforce training and what that could mean as far as people's opportunity. And Mike, I know that there's some thinking in the health sphere around workforce, particularly with the new medical school and some training going on there.
Yes. So there are a lot of synergies that are being captured through, as Sherri said, through the medical school, but also through the school district.
Right.
And I think about what's happening at Eastside, just the great training programs, because those young people are going to have a direct pipeline, whether they want to go on to advanced allied professions or med school, or just have a career in the health arena. Even if they don't have a certificate, it's going to give them a great platform to be able to do that. And open up any news source online or in print and look at discussions around gross domestic product, GDP, and economically, and you'll see that a huge chunk of our dollars, our overall economic power in this country, in this state, in this county, is spent on healthcare. And so that is going to be a viable employment source for years to come. And just look at the demographics alone, and I think that puts you on a solid trajectory. But it can also be some of the more rewarding careers. And when you talk to people that work in our community care clinics, what you see are folks that are just, it is truly a labor of love for them. And you're able to develop a relationship with human beings because you're caring for them from perhaps when they're this tall or this long to, as tall as me. And you're able to walk with them in their journey throughout their lives. And that can, it's very tiring. If you do your job right, at the end of the day, you're tired, but it is a great career to be able to get into. And so we're excited about being able to partner with not only Del Med, but AISD, and hopefully more in the future. But also, our board has set aside funds in our budget this year and to start looking at what can we do on our own and supporting these other groups to help with workforce solutions and advanced training.
Yeah, I want to mention one other thing. Earlier, you talked about smart cities and technologies, and there is a whole disruptive market occurrence going on right now with new technologies, automation, and different ways of doing business. And there's a real threat out there that this will displace what arguably is the largest employment sector in the United States, and that's the transportation industry. Think of taxi drivers, think of UPS drivers, truck drivers, and so forth. But the good news is probably 40 years before that really has a noticeable effect. But in the meantime, we need to start shifting to new employment models and new opportunities. A lot of these new technologies are very dependent on programming and apps and market-driven activities. That is what Austin's always excelled in, but I'm putting out a plea, and everywhere I go, we've got to get started now. We've been talking to AISD, we've been talking to ACC, Houston-Tillotson, UT. Everybody's interested in putting together training programs, everything from technicians to PhD students. We need that whole range. This is an exciting new world where business opportunities can change overnight, markets can change slowly overnight. We talked about we talked about the taxi industry and the impact of TNCs. My understanding is the last public taxi system in Waco has just shut down, and so they're now without a taxi system dependent on TNCs, which I don't know if that's that bad for their customers. But clearly the market is changing, and we need to be aware of that with regards to future affordability.
Well, clearly it is, and there are a few cities, New York City being one of them, that is able to get data from its ride-hailing companies, the TNCs as we call them, and there are lots of disruptions occurring. We could spend an entire panel on that, so we'll keep moving.
Right.
And along that line, there was another question on this theme of workforce development. I'm wanting to know if AISD could connect the programs that you have for the non-college bound students to their ability to afford housing. Is it possible to make that connect to say, let's have programs for folks who aren't college bound but who are going to be in these other up-and-coming areas? Is there a way that we can train them in such a way that they can earn a good living in an area like this that's going and blowing, right, and be able to afford housing?
I think there absolutely is. I've always wondered in education where you typically are 17, 18, or 19, you finish high school and you do English 4 and government, all these, and then all of a sudden 3 months later you're ready to take college courses. And we said, we have kids who are 14 years old, 15 years old, ready to take college courses. And so we actually set up 2 early college high schools where students can earn up to 60 college credit hours. We pay for their textbooks, we pay tuition. We also set these up in their 2 highest poverty areas of the school district, in our high poverty areas of the city, and it's LBJ and Reagan. And we've had now 3, I believe it's 3 graduating classes now of students who live there. So it's not a magnet school. So students who live at Reagan and LBJ, they actually can enroll in an early college high school. It's a great partnership with the Austin Community College. Kids begin taking courses as freshmen. And they still have to be college ready, so it's fully bona fide college courses, and earn an associate's degree. And that is amazing, because I do think that's a game changer for our kids who have not had the opportunity, have not had the accessibility. And I mean, college courses were around even when I was in high school 100 years ago. But you had to do it after school. You had to go figure it out. Yeah. Your parents had to know how to maneuver through the system. That's, we figured out as an institution.
That's not equitable. That's not providing equitable access.
It isn't. No. People wouldn't. Right. And so we said, no, if during the school day, you're going to take these courses. And providing those opportunities. We opened up 2. Now we have 6 early college high schools. All of those in the highest poverty areas of our school district, to give kids that upper chance. Because I do think with a strong education and then partnering up with their Chamber of Commerce is looking at the jobs that are going to be ready in the future or needed in the future. So that's where with our health professions school and also career launch opportunity in health professions that we opened up this year, we were hoping to get 50 students. We actually have 90 students at LBJ with a waiting list for students still trying to come into career launch, which is where they can earn an associate's degree in 6 years, high school for 4, and then an associate's degree anytime in there, but also have the certification ready to work and to continue on to post-secondary studies if they want to. But many of our families or kids are going to have to work and go to school. And at Reagan, we were actually we opened up this year cybersecurity. Yeah. So these are just opportunities, what we call career launch, and these are career opportunities for kids. They can continue on to a 4-year college degree if they want to, but they come out with a 2 years certification ready for their
Ready for
jobs.
work. And these are jobs where they can earn a good living and
That's
afford
correct.
housing. Christina, I want to turn to you for a moment because I know before attending graduate school, you were recently a classroom teacher here in the Austin Independent School District. So your perspective on some of what you've been hearing.
That's a great question. So I taught 4th grade in a Northeast Austin school, and that neighborhood is experiencing rapid growth. And kind of like Dr. Cruz mentioned, families are coming to the realization that they're unable to stay in their housing and having to leave in the middle of the school year. And that has a lot, that mobility, that frequency of moving can negatively impact academic outcomes. That consistent attendance is hugely important to building positive school communities, ease for teachers to be able to teach. Mobility in those East Austin communities is really unstable. And that has an effect on Austin schools and Austin teachers. And so that's what I was seeing. I was seeing, that quite frequently during my time as a teacher.
So you saw a lot of what we're calling housing instability,
Right.
People who are having to move frequently because of affordability, and they don't have safe, stable, clean, affordable housing with the education necessarily that they want, with the health care, with the transportation that they want. So you saw that right there in the classroom.
Right. Sure. And a lot of times they don't want to leave. They don't want to leave their
Right.
school communities. They have deep ties.
Right.
And it's a really difficult decision, but it's one that they kind of are forced to make. And a lot of times parents, they understand those negative effects,
They just
of
don't have a
mobility.
choice.
Right. They didn't have a choice.
Mike, you
And
wanted
I
to
think
add
that,
something?
you saw what the stresses cause, if you will, on those families and on those kids. And I think that points to a certain element of health, and that's brain health or mental and behavioral health. You'll hear both terms used interchangeably, and I think that's important because when we talk about the stresses on individuals, it's not just the physical health, but it's the mental and the emotional that we think, oh, it's going to be a tough time, but they'll be over it in a month. Maybe not. That can be a very traumatic experience that can have some very adverse effects on individuals and exacerbate what is a latent condition and really bring it up to the surface in a destructive way.
A latent condition or a new condition, as we've said, this is all linked. So if you are leaving your community, whether it's the community you grew up in or a community where you have friends as a child, and you're in surroundings where you don't feel that sense of community, or you don't have access to the kind of food that you would like to have, or the kind of cultural, the soccer league that your child was in, all of these things matter. We know that can lead to depression, and we know that depression not only has the effects as far as psychological, but that there are real health outcomes. I know that there are some here with us who work with the homeless, and we know a lot of what we see with people who, Mike, as you were saying, one little thing happens that disrupts them, and you fall in a notch, right? You fall in a notch. You may now be homeless, or when we're in our research looking at what we call the typology of housing, we're looking at folks who are not technically homeless, but, and we just in a focus group yesterday heard from 2 individuals who were not, 3 who were not technically homeless, but one was, 2 of them were living with family members, and one had been on the streets just a week ago with drug issues. Another one had been on the streets just a month ago with drug issues and was able, through the help of clergy, to find one room to rent in a house. And another individual, this individual was, due to just the economic stresses, living with his mother and didn't have a bedroom, was living in the dining room. So this housing instability, I know, is real. We're coming to the end of our time, but we've had a theme here of working together, and certainly that's a big theme of this conference, and I want to thank you for that. So I'd just like each of you to say, you know, kind of draw out of your wish list. If there was one thing that could happen, being the eternal optimist that I am, what would that be for you in this realm?
Okay. Well, I think, first of all, it's just the awareness and having people with that ethic of caring who are coming to help others. And it's always, I think that's always extremely important. So just having the conversation today, having other agencies that are represented maybe in our city, maybe not be here at Communities and Schools is one,
Sure.
that had a speaker of a student once that he's a student at UT, but he had talked about losing his house for the first time. His mom went to go pick him up at school and she said, we're not going to go home, we don't have a home. And pretty significant story, that was in middle school. And that was devastating enough as I was listening to him. What got me more is when he said the fourth time it happened, and that just sort of hit me. And those are things that are hard for somebody of my age to deal with, but here's a student talking about the story, and it's the fourth time it's happened. It goes back to that instability, that unknown, and so that wishes that with different organizations coming together to shape policy, to use resources in different ways, to look at the future, use technology in different ways, but really coming together with different entities to make this a better Austin for all.
Rob?
Yeah, I would ask everyone here to help be an evangelist about this idea that mobility is a commodity and that we need to increasingly think about being good consumers. And so when you advise or work with people about affordability, to think about, okay, that transportation cost, that cost in choosing to go to the hinterlands, if you will, to find a residential location.
Sure. Okay. Christina?
We heard earlier about the deliberate relocation of black and brown people to the east side of Austin and how that segregation persists today. So I think my kind of wish list would be finding opportunities to locate affordable housing in high opportunity areas and the difference that can make in our communities.
Thank you, Christina. Mike?
And very similar, I think that as we work towards the healthcare delivery strategy and the geography of health as it relates to people and places, you know, where they are and who they are, is being part of that center of that community, and again, being part of the overall infrastructure that helps hold things together for individuals so that they can have a great life, and not just deal with, you know, going forward with some of the racial inequities and disparities, but actually reversing them for people that are living today. I believe we can do that.
And so do I. I know we all do. I want to thank Housing Works, the Federal Reserve of Dallas, all of the sponsors, all of you for being here, and each one of you who, when I called and asked if you would be on this panel, actually said yes. Thank you all very much. Appreciate it.
Thank you. Good job.